Well, I mean, I could say just from a personal uh, sort of perspective, having like knowing people who are refugees, Syrian refugees, and knowing that they don't want to go back. There are many reasons, including, well, is this is the situation in Syria going to actually turn around even if a political settlement is reached? How do these people know if they're going to be targeted by the regime or not? Is there going to be, I mean, why would anyone leave a place that has the security and um, safety, maybe more opportunity, at least in Europe than, let's say, in Jordan or Lebanon, to go back to Syria? It's so I think
Also,
that
it's
there's
been
definitely a divide in people like not realizing just how bad things are in Syria, and that they're not going to turn around if a political settlement was reached.
also like let's take it from the health standpoint, since that's where I approach things. You're talking about people returning to a country where the healthcare infrastructure has been completely demolished and the healthcare workforce has largely left. So even on, let's ignore every other aspect of somebody's life. Why would you go somewhere that you literally cannot get healthcare for you or your loved ones, including the elderly, including children? There's no doctor to see you. And now there's been a global pandemic that's gone on for 18 months. So I think that's front and center in people's decision making. And so part of the work, one of the research projects I'm engaged with right now is looking at how healthcare factors into these return decisions. And it's largely that it sort of pushes people, they know that the healthcare infrastructure has been destroyed. They know that there's not doctors there for him. And then think about that across sectors, like it's not just in healthcare. So there's really no incentive system to go back.
Well, we did a recent episode on Lebanon, and one of the I know that now there's definitely a medical brain drain going on in Lebanon as well. And so, it's similar patterns, and not just in terms of like the actual staff, doctors, nurses, what have you, but even medical supplies and and pharmaceuticals, that all of that is severely lacking. And so, yeah, I think that it was Denmark recently said that they wanted to send a bunch of Syrian families back, that they said, oh, things are better now in Syria. And so it's unbelievable when you have governments saying this. It's
From
pretty
a,
crazy.
yeah, from a host community government standpoint, I mean, I think, view it as they've struggled with this for over 10 years now, and that's an easy solution, right? And so it's a matter of showing, and the research on return, like what are some good examples of return migration that we've historically seen? There's very few, like maybe the Balkan case, maybe parts of the, maybe there's some return in Iraq. Like there's
Barely.
there's barely a good case of this. And so it really, I don't know, it's really interesting that people kind of default to that as the easy answer, where in my mind we have no proven track record of this working ever. So why would it work now, particularly in this situation that's politically, socially, economically fraught in so many different ways?
Yeah, I mean, there isn't a clean solution to it. I mean, I think people would love to return to their homes if their homes even exist at this point. But the amount of destruction that's happened in these places, there isn't a place to go back to. So you're dealing with diaspora and migrant communities. I think that generally the international community should be a little bit more sympathetic to the fact that migration is a natural part of human history. Like we've had
Well,
mass migrations in the past, and we need to just deal with it and find the best way to deal with it.